NBC News, this is Today with Hoda and Jenna Bush-Hager, live from Studio 1A in Rockefeller Plaza.
There is a lot of progress that's being made here, but again, there's more to be done.
Okay, so what should you know before you go see your doctor? We're going to have an expert weigh in after this.
For the women and men who have or will receive a breast cancer diagnosis, it's really important to take control of your health and your treatment options.
Here with help is Dr. Stephanie Graff, medical advisor to the Dr. Susan Love Foundation and director of the breast cancer program at Sarah Cannon Cancer Institute. Hi, Dr. Graff.
Dr. Graff, it's good to see you. We just did a piece, Dr. Graff, on two women who were sort of decades apart in their treatment. And we always wonder, like, how far have we come? So if you were to kind of size up how far we've come in the breast cancer fight over the past 2 decades, how would you characterize it?
We've made amazing strides, and you heard the difference between Lisa and Bess's stories in the advances that have been made. And I think that that's all possible because women have been participating in clinical trials and raising money for cancer research that helps us move forward. I think, a lot of patients don't necessarily think about clinical trials, but they're a very good option for treatment of cancer, and they help you get the latest treatment today so that patients can have that shortened course of radiation that we just learned about and potentially make this same segment on the Today Show in 2045 even better if we keep having opportunities for more clinical advances.
Yeah, that treatment, Hoda and I both were astonished.
Why isn't everyone doing that if that's a possibility?
Yeah, I think that more and more across the country, we're seeing that women are doing what we call accelerated partial breast radiation, where it's done in much shorter fractions, doses of radiation over time. And we're just going to continue to see advances like that. There's research being done to minimize everything from surgery to the cancer treatment in terms of chemotherapy or medicines to hopefully make them more targeted and tailored for women. There's just lots of opportunities.
Let's talk about mammograms. I just got my first one. And what are the current guidelines? And for those of us that are a little nervous about doctor's appointments and the time of COVID, what do you say?
So I still think that the best recommendation is that for women to start doing their mammograms every year, starting at age 40. That's my recommendation in my clinical practice at Sarah Cannon. That aligns with the American College of Radiology and the National Comprehensive Cancer Network guidelines as well. There is some controversy, so I think it's always okay to talk to your physician about what might be right for you. In the times of COVID, the health systems in the country have really had this same length of time in the pandemic that the rest of us have, and I think they've really figured it out. At my facility, everybody's masked with a mammogram. You get to keep your mask on, which helps ensure that you're as safe as possible. All of the healthcare team is going to be wearing masks. Everybody has enhanced safety protocols in place to keep patients safe. So go in and get that mammogram. During the pandemic, we've already seen reports that the rates of breast cancer diagnosis have dropped by 50%, which is startling because it's not that there's 50% less breast cancer. It's that 50% less women have been going in to do their screening. And I'm worried that in the future, that means we'll have a lot more late diagnosis of breast cancer.
Yeah, I remember we had Dr. Love on the show here, and we always wondered what the cause of breast cancer is. Like, why do you get it? And I remember when I was diagnosed, they only asked 2 questions when I arrived. They wanted to know, A, if it was in my family, and B, if I was on birth control. And Dr. Love talked about expanding the questioning to find out, like, what are people eating? Where do you live? Are there power lines? I mean, who knows what may be the cause of this? But have they expanded that questioning so we could kind of narrow down how it is people are even getting this in the first place?
Yeah, there's still a lot of research ongoing to look at questions like environmental toxins or diet and how that overlaps with a woman's other risk factors to increase her or his risk of developing breast cancer in their lifetime. And so what I would encourage patients to do if they're interested in those questions is to consider joining Dr. Susan Love Foundation's Love Research Army. The Love Research Army is sort of a big list of big email list that sends out regular updates on cancer clinical trials that are happening. And that includes things like breast cancer prevention and screening trials, so that if there are studies looking at things like diet or exercise or other environmental factors that might increase our risk, persons listening today on the Today Show can hear about that. It might not be right for them, but they can tell their neighbor or their child's teacher, somebody that it is right for, and help us figure out those questions with a little bit more clarity.
Well, in addition to being a great doctor, you have a great bedside manner, and you really explained it very clearly. So thank you, Dr. Graff. We really appreciate it. Thank you so much.
All right. Thanks, guys.